Ever feel like you need a shortcut to understand these really complex medical breakthroughs, especially the ones that could, genuinely change lives? Well, today we're doing just that, taking a deep dive into some pretty groundbreaking news in cancer treatment. Our mission today, it's to unpack the final results, the 6-year outcomes, from a major clinical trial. It's called CheckMate 9LA, and it focuses on a specific treatment for metastatic non-small cell lung cancer, NSCLC. That's lung cancer that's spread, and it's notoriously tough to treat.
Exactly. And our source for this, it's a really comprehensive scientific article just packed with data on these long-term results. So our job really is to pull out the most important stuff, the key insights, and give you a clear picture of what it all means. Think of it as getting you up to speed quickly on some vital research.
Yeah, precisely. We're going to dig into why this specific treatment combo, that's nivolumab plus ipilimumab, plus a short bit of chemotherapy, why it's showing such, well, durable benefits, even for patients who historically have faced really difficult prognosis. It's not just about living longer, it's about the quality of that longer life, right? And what this hints at for future care.
Right. So maybe let's set the scene a little. Metastatic NSCLC, it's historically been a real challenge. Once lung cancer spreads, it just becomes much harder to manage. And the outlook, well, it often wasn't great.
And that's where things like immune checkpoint inhibitors started to make a huge difference. We hear about drugs like nivolumab, ipilimumab, they're often called revolutionary. Can you give us a quick refresher on how they actually work? Why are they such a big deal?
Sure. Basically, think of your immune system having brakes. These brakes stop it from, attacking everything, including your own healthy cells. Cancer cells are clever. They can learn to hit those brakes, essentially hiding from the immune system. So checkpoint inhibitors like nivolumab that targets PD-1 and ipilimumab that targets CTLA-4, they work by releasing those specific brakes. This lets your own immune cells, your T cells, recognize and hopefully attack the cancer cells more effectively.
Okay, so two different ways of taking the brace off the immune system. But CheckMate 9LA, they didn't stop there. They added chemotherapy, just a short course. Why do that? Isn't immunotherapy supposed to be the standalone star?
That's a really good question, and it gets to the heart of the strategy here. The idea was quite innovative, combining these two powerful immunotherapies with a sort of strategic short burst of chemo. The thinking is, well, chemotherapy doesn't just kill cancer cells directly. It can also sort of kickstart an immune response against the tumor. It might break tumor cells open, releasing things called antigens, which then help the immune system see the cancer. But it's like priming the pump. So the chemo gives you some early disease control while potentially boosting the long-term punch of the immunotherapy, kind of 1-2 combo.
Right, immediate effect plus long-term boost. And this was all tested in the CheckMate 9LA trial, global, randomized, phase 3, big deal. And what makes this report we're looking at so important is that it's the final 6-year data. Efficacy, safety, the whole picture. And apparently this is the longest follow-up we have for any trial, looking at single or dual checkpoint inhibitors plus chemo in metastatic NSCLC. 6 years is, well, it's a long time in cancer research.
It really is a monumental time frame, especially for advanced disease.
Okay, so we've got the context. We know the players, the drugs, the chemo, and the rationale. Now the big question. After 6 years, what did they find? What's the headline result for patient survival?
Well, the main finding is pretty clear and very positive. The combination Nivo plus Ipi with chemo, it showed a continued definite overall survival advantage compared to just chemotherapy alone. Looking at the numbers, the actual rates at 6 years. It was 16% overall survival for the combination group versus 10% for the chemo-only group. That's a noticeable difference when you're talking about surviving 6 years with metastatic lung cancer.
16 versus 10%. And they also talk about a hazard ratio, right? It was 0.74. For those of us maybe not living and breathing clinical trial stats, what does that 0.74 actually tell us?
Yeah, good point. So the hazard ratio, think of it like this. If the number is less than 1, it means the risk of the event in this case. Unfortunately, death is lower in the group you're looking at compared to the control group. So 0.74 means roughly a 26% lower risk of death at any given time point for patients on the combination therapy compared to those just getting chemo. It's a pretty solid indicator of benefit. And we also saw this benefit carry through for progression-free survival, PFS. That's how long patients live before their cancer gets worse. At 6 years, PFS rates were 9% for the combination versus only 3% for chemo. So delaying progression too.
Okay, so better survival, less progression. But here's what I find really interesting. Sometimes these fancy new treatments only work for a very specific subgroup of patients. Was that the case here, or was the benefit broader?
That's actually one of the most striking parts of these results. The benefit, this sustained overall survival advantage with the combination. It was seen pretty much across the board. It didn't really matter what the patient's tumor PD-L1 expression level was, or the tumor histology, the type of cancer cell.
Okay, let's zero in on that PDL1 thing for a sec, because that's often a big decider for treatment, isn't it? What about the patients with PDL1 less than 1%? That group often has a tougher time, right? Poor prognosis usually.
Exactly. That group is historically challenging. And here, the results were, well, quite dramatic. For those PDL1 less than 1% patients, the 6-year overall survival was 20% with the combination therapy versus just 7% with chemotherapy alone.
Wow, 20 versus 7, that's nearly 3 times higher.
It is a really significant difference for a group that often doesn't respond as well to, say, single-agent immunotherapy. Now, for patients with PDL1 greater than or equal to 1%, the rates were 15% versus 10%. Still a clear benefit, but that jump for the low expressors is really something.
Okay, and what about histology? Squamous versus non-squamous NSCLC, those can behave differently too.
They can. And again, we saw the benefit in both. For patients with squamous NSCLC, another group that could be difficult to treat, the 6-year OS rates were 14% for the combo versus 5% for chemo.
Again, nearly 3 times.
Yep. And for the non-squamous patients, it was 70% versus 12%, still a solid advantage. So what's really fascinating as you look at this is that this specific combination seems to provide maybe an even greater magnitude of benefit in these populations that traditionally have poorer outcomes, the PDL1 low, the squamous type, compared to what we've seen with some other chemoimmunotherapy combinations. It really highlights the potential synergy of this nivo-ipi-chemo approach.
So the bottom line seems to be this combo really delivers, especially for those patients who need it most. That's really encouraging. Okay, so people are living longer, but what about the response itself? How long did the treatment actually keep the cancer under control? Are we talking durable response?
Absolutely. Durability is key here. First off, just getting a response tumor shrinkage was more likely with the combination. The objective response rate, or ORR, was 38% versus 25% for chemo. But the really impressive part is the duration of that response. The 6-year duration of response rate for the combination therapy was 19%.
19% still responding after 6 years.
Yes. And compare that to the chemotherapy arm. This is quite striking. By the 6-year mark, 0 patients in the chemotherapy arm were still considered to be responding. Every single one had either progressed, stopped responding for other reasons, or was censored before that time point.
0. That's
It
just...
really highlights the difference. And what makes that 19% durability even more remarkable is remembering that patients on the combination arm were mandated by the study protocol to stop all treatment after a maximum of 2 years.
Wait, so they stopped treatment after 2 years, but the response continued for years longer in nearly a fifth of them.
Exactly. It suggests that the treatment might be inducing a long-term change, maybe reprogramming the immune system in some way so it continues to control the cancer even without ongoing therapy. It's not just about suppressing the cancer while you're on the drug, it's about a potentially lasting benefit. That's a really powerful concept.
That is amazing. The idea that the benefit outlasts the treatment itself by so long.
Yeah.
Yeah, that makes you think differently about what treatment even means long term. But okay, powerful treatments often come with side effects. What did the 6-year look tell us about long-term safety? Any new red flags popping up after all this time?
Thankfully, no. The safety profile remained really consistent with what had been reported earlier in the study. Critically, there were no new safety signals identified between the 5-year and 6-year analyses and no additional treatment-related deaths. Also, importantly, no new cases of those immune-mediated adverse events, the side effects specific to immunotherapy, occurred after the 5-year point. That's quite reassuring for long-term follow-up.
That's good news. And didn't you mention something really interesting, almost counterintuitive, about patients who had to stop treatment because of side effects? Treatment-related adverse events, or TRAs.
Ah, yes. That was a fascinating exploratory analysis they did. They looked at patients who had to discontinue the nivo-ipi-chemo regimen specifically because of treatment-related side effects. And even in that group, the 6-year overall survival rate was 34%.
34%. Even though they stopped early due to side effects, that seems high.
It's remarkably high. It really challenges that conventional wisdom that if you have bad side effects and have to stop treatment, your outcome will necessarily be worse. It suggests that, perhaps for some patients, getting that initial intense immunotherapy boost, even if it's shorter than planned, might be enough to set them on a path towards long-term control. It implies a really durable impact from the treatment, even if tolerance limits the duration. That's potentially great news for patients worried about managing side effects long term.
Yeah, that could really change conversations about risk versus benefit.
Right.
Okay, one last area they looked into. Somatic mutations. These are like genetic typos in the cancer cells themselves, right?
Yeah.
Things like KRAS, STK11, KEAP1, TP53. Did having these mutations affect how well the treatment worked?
Right, those specific genes, KRAS, STK11, KEAP1, TP53, are commonly mutated in lung cancer, and sometimes they're associated with resistance to treatment or just generally poor outcomes. But what the analysis here showed was trends towards improved overall survival with a combination therapy, pretty much regardless of whether these mutations were present or not. Now, patients with these mutations did tend to have shorter survival overall in both arms, which is kind of expected. But importantly, having one of these mutations didn't seem to cancel out the benefit of the combination therapy. For instance, they pointed out that almost a third, 32% of the patients who survived for 6 years on the combination arm actually had KRAS mutant NSCLC.
So even with a bad mutation like KRAS, a significant number still got that long-term benefit from the combo.
Exactly. It just further reinforces the idea that this regimen has broad applicability across different molecular profiles of NSCLC.
Okay, so wrapping this all up, this final 6-year look at CheckMate 9LA, it really delivers some strong evidence, doesn't it? Durable, long-term benefits for this Nivo-Ipi-chemo combination in metastatic NSCLC. We've seen clear wins in overall survival, progression-free survival, and especially that amazing duration of response. And crucially, these benefits extend even to those patient groups that have traditionally been very difficult to treat.
Absolutely. I think if you connect this to the bigger picture of lung cancer care, these results really solidify this regimen as a valid and efficacious standard of care option for first-line treatment. And that sustained benefit, the durability, especially the fact that it continues after treatment stops, is particularly noteworthy. It suggests something profound might be happening with the patient's immune response.
It really does. Which leads us to that final thought for you, the listener, to maybe chew on. Given this incredible durability, where responses last years after treatment ends, what kind of new strategies might we see emerge from studying just how long these immune changes last? And, how could understanding that better reshape how we approach long-term care, maybe even treatment duration itself for people living with advanced cancers in the future?